Hi, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is spinal cord stimulator implants and psychological screening. Now, a spinal cord stimulator implant is a device that goes just over the spinal cord area and emits slight electrical impulses that can alter the way that your brain perceives those signals as they come up. It can be a great last resort option for individuals who have failed considerable conservative treatment, have gone through surgery and that failed, those types of things. So surgery is no longer an option, but the electrical stimulation can be a nice low-risk way of getting pain relief. Now, before you have a spinal cord stimulator implant, there are two things that need to happen that almost all insurance companies require. What's the first? The first is a trial implant that's put in as an outpatient by your pain management doctor, and you wear it for 5 to 7 days. So it's a little kind of catheter lead that goes up around the spinal cord. The lead comes out through the skin, sterile dressing, and you have a battery pack and you see if it's going to work. That's step one. Then if after 5 to 7 days you get more than 50 to 80% pain relief, then you're indicated for the final implant. And all of that goes under the skin. You don't have anything hanging out of the body, okay? But now you need the psychological screening. And then you sit there and say, why do I need that? I already know the thing's going to work. Let me just get the implant. Not so fast. There have actually been studies looking at this. Why is a psychological screening necessary? And when it's done, does it actually pick up stuff? Is it a good thing? Well, first it should be clarified that spinal cord stimulator implants are not cheap. They're about $15,000 to $18,000, sometimes more, but they're a highly technical device that is very advanced. So an insurance company is not too excited about, doing that for you unless they're sure that it really has the highest chance of working. So a psychological screening has been shown to have a high predilection for picking up a psychological problem. What do I mean by that? Well, there's disorders called catastrophizing. There can be depression, anxiety, multiple different things that can be picked up. Now, if that wasn't done, there are studies looking at the outcome in those who have those conditions that are not being well treated, and the answer is they do okay, but they don't do nearly as well as in those who don't have those mental health conditions. Okay? So the best outcome is when, if that's diagnosed, you get treated for it and then you have your spinal cord stimulator implant. It doesn't mean, oh, you can't have one ever. It just means, okay, well, it looks like you have some depression here or whatever the outcome is. We should treat that first. Okay, so I think it's a good thing. All right. Now, another thing that should be noted is that other studies have looked at spinal cord stimulator implants with regards to, say, depression. And they've shown that it actually can help a lot. And it just stands to reason, right? I mean, you get a spinal cord stimulator implant, it works well, your leg pain, back pain, or both get mitigated or modulated so that it's less. Then you're able to be more active. You're happier. So your depression will, hopefully decrease just as a result of that. But psychological screening can really help. So don't, poo-poo it or say you don't want to do it because they're going to require it, and it can be helpful in picking up something that you didn't know existed. Okay? I'm Dr. David Greene with the Arizona Pain Network. Arizona Pain Specialists offers spinal cord stimulator treatment. They have multiple board-certified, fellowship-trained pain management doctors who are experts at all facets of pain management. Visit us on preferredpaincenter.com. You can call us for one-number scheduling at 602-507-6550. I'm Dr. David Greene, Arizona Pain Network. Your pain stops here.